Hi, and welcome to the Functional Relations Podcast. I am Zachary Bird.
And I'm Caleb Davis.
Why is it taking 3 seconds to are you not hearing me in real time?
Sorry, no, I was not paying attention.
Okay. Welcome to the Functional Relations Podcast, where we set aside time to have engaging conversation on relevant topics related to behavior analysis. I'm Zachary Bird.
And I'm Caleb Davis. Hi, Zach.
Hey, Caleb. What's up?
Just ready to talk about some more ethical things.
You're going to talk about some ethical things before you go throw axes, I hear.
Yeah, I'm going to do some axe throwing later today. Should be a good time.
Do you think you're a good axe thrower?
I don't know. I mean, I've never really thrown an axe that I can remember, but I did grow up in...
Then you're definitely not a good axe thrower.
Well, what I was going to say is I did grow up in Maine, though, and so there could be like some...
something in the water?
Phylogenetic, predisposition. I just pick up an axe and I know what to do with it.
I think the only thing that I am familiar with axe throwing is when I was a kid and I used to watch Dr. Quinn, Medicine Woman.
Sully?
Her boyfriend.
Was it Sully?
I have no idea. Would throw axes, and that was always impressive to me. So,
I'll let you know how it goes.
Thanks.
But we'll see. But we're not here to talk about axe throwing.
It is Sully, by the way. I just looked it up.
Yeah, I know Dr. Quinn Medicine. I'm familiar.
Very good. Yeah, so what is the topic today?
We're going to talk about punishment.
Punishment. Oh, yeah. So this is Season 1, Episode 4 of the Functional Relations Podcast. This is our ethics season, and we're going to talk about punishment.
Punishment is such a general term, right? Punishment.
Yeah,
when I think punishment, I think of in my mind anyways, I have the big four. You have discriminative stimuli, you have motivating operations, reinforcement, and punishment. Those to me are the big four. And we're tackling the ethical implications around one of the big four today.
All right.
So that's I don't know. Maybe it
does
maybe
feel
I'm trying
bigger.
to hype it up too much.
Maybe. Yeah. I don't know. I think you're right. I mean, it's a big thing.
It's like reinforcement. If we were we're going to talk about the ethical implications of reinforcement today, it's
wow,
that would be pretty big.
Yeah.
So I think it's just its counterpart.
That's right. All right. So I guess what we're considering is the ethical implications of the use of punishment in behavioral programming.
That's right.
Okay.
Right, because that is part of it all comes back to the ethical code, right? So there is in our ethical code some important considerations around the use of punishment. Do we want to, before we get started, do we want to just reference that code so we all get on the same page?
Yeah,
so we know,
might as well.
We can kind of use that as a basis of talking about it.
Okay. Do you want to pull it up?
Yeah. Okay. So in the BACB's ethical code, 4.08 is considerations regarding punishment procedures.
All right.
And so there are four, A, B, and C.
The big four.
And D. Not the big four, just four.
The little four.
Just the average four. All right, so A is behavior analysts recommend reinforcement rather than punishment whenever possible.
Okay.
That should come as no surprise. The next one is if punishment procedures are necessary, behavior analysts always include reinforcement procedures for alternative behavior in the behavior change program. So it's don't use punishment by itself, right?
Okay.
The next one, before implementing punishment-based procedures, behavior analysts ensure that appropriate steps have been taken to implement reinforcement-based procedures unless the severity or dangerousness of the behavior necessitates immediate use of aversive procedures.
Have you ever said the word dangerousness before?
No, I didn't even know that was a word, but I'm definitely going to say it. It's like it's a made up word when I hear it.
Yeah.
Like if I said it in everyday life, like somebody would be like, "Oh yeah, dangerousness."
Yeah, exactly. Yeah, right.
And I'd have to be like, "No, I swear it's a word," and look it up and like completely disrupt what we're talking about to like prove my point.
Yeah, right.
Yeah, it's a dangerousness. It's a real word. Okay. And then the final one, D. Behavior analysts ensure that aversive procedures are accompanied by an increased level of training, supervision, and oversight. Behavior analysts must evaluate the effectiveness of aversive procedures in a timely manner and modify the behavior change program if it is ineffective. Behavior analysts always include a plan to discontinue the use of aversive procedures when no longer needed.
That's a long one. So basically,
Yeah.
the idea is that because they're procedures that may not be, recommended to use very often, you have to keep checking in to make sure it's working. And then if it's not working, you make adjustments, right?
Yeah, I think so. Yeah, so it's kind of like, when possible, don't use punishment at all. So punishment shouldn't be like your default, or a punishment component shouldn't be your default, right?
Right.
That's the way I kind of think about it. Like reinforcement only should be your go-to, and then you like if you need a side of punishment to be effective, maybe you bring that in. Is that
your
kind of what
main
you
dish
think about that?
should be reinforcement. It's like your main dish should be. So it's kind of like your the punishment is like your dessert. You never want it as a main dish. Don't worry, Caleb. We'll cut that.
Yeah, right. Some tasty aversive stimulation to finish off a meal.
All I was trying to say was that your main dish shouldn't be punishment. It should be something, it's at the top of the food pyramid. It's at the top of the behavior procedures pyramid.
Okay.
All right. So one of the things I noticed up front is that they talk about reinforcement, but they don't specify positive reinforcement. So it kind of leaves open the idea of negative reinforcement. Do you have any thoughts on that one?
Yeah.
Because negative reinforcement, you're using aversive stimulation, right? And so
right.
it seems like they talk about aversives, but maybe it's a little bit unclear. Are there any restrictions on negative reinforcement procedures?
Yeah, that's interesting, right? Because it says you should use reinforcement rather than punishment, but then through the rest of the items, it refers to aversive procedures, which, yeah, if you're using negative reinforcement procedures, those could be aversive.
Yeah.
Or they require aversive stimulation.
Right.
So that's kind of, that's interesting. But it's like, yeah, should we reduce the use of punishment and then also reduce the use of aversive stimulation in general?
Yeah. It kind of reminds me of Murray Sidman's book Coercion and its Fallout. He basically defines coercion as everything but positive reinforcement, basically negative reinforcement and both of the types of punishment. He considers that as coercion. So I don't know, but that's interesting, I guess, to think about.
Yeah, we've reviewed the ethical code that, everybody I'm sure is familiar with this. If you have your BCBA certification, you know this. So
Right.
With that in mind, so we got that down. Let's talk about what that means for everyday behavior analysts.
Yeah, exactly. So are there things that what kind of ethical implications does this bring to your mind?
Yeah, so I think something that I've thought about in the past is, and it relates, I think, to 4.08a, where it says the use of reinforcement procedures instead of punishment when possible, or without punishment when possible. I think of commonly used procedures in the field of behavior analysis. And sometimes I wonder, if those procedures in some way rely on, or the underlying mechanism might be a punishment component that might sometimes be implemented as an initial intervention.
Yeah. Okay.
Do you know what I'm saying?
Can you give me an example?
I think a common one are DROs.
Oh, the dreaded DRO.
Yeah, right. So DRO, obviously differential reinforcement of other behavior, right? So it's like that's a reinforcement procedure, right? Like everybody, when you look at it, it's like differential reinforcement. We got a reinforcement procedure, like no questions there. But I know in Catania's textbook, Learning describes the DRO as a negative punishment contingency, right?
So it's the idea that you're at the end of the interval, contingent on the behavior occurring, you remove access to the whatever the person was earning.
Right. It's like it's scheduled to happen as long as you don't do the thing, like whatever the target behavior is. And if you do the thing, then that next scheduled delivery is canceled. Like, so you could see that it's
your
like
birthday's canceled.
Wait, what did you say?
I said your birthday's canceled.
Right. Yeah. No birthday.
I don't know why that came to my mind. I feel like
that'd be awful. Be like, if you mess up at all this year, no birthday.
Oh, I know what it was, actually. I was listening to the Joe Rogan podcast, and he had Dr. Phil on there, and Dr. Phil had an example of as a parent who would threaten the removal of the birthday. And so he was, Dr. Phil, I don't really know much about him other than he's a psychologist who feels it's appropriate to do counseling on national TV. But other than that, he had
there could be some
advice.
Ethical implications with that.
I'm sure there's some HIPAA forms signed or whatever, some releases.
Yeah, I'm sure that's okay.
But he was talking, and he was basically giving an example of how this parent was saying they were going to cancel the kid's birthday, and then Dr. Phil said, well, think about how he made some good points. There's such a delay to the birthday that it probably won't have an effect on a 4-year-old, and plus, he said something about when they're an adult, we want them to have good memories, and are they going to remember why they lost their birthday? No, they're gonna remember that they didn't have a 4th birthday. And so, anyway,
they turned 4 twice.
Right.
You have to wait till next year to be 4. It's like you're like being held back an age.
Yeah, right.
I repeated the 4th year.
Yeah.
Yeah. Okay. So, anyways, that's something that I've always thought of as like if you use a DRO as a default procedure, you initially just throw that in. I've always kind of thought about I don't know, is that kind of more like a punishment procedure that you're using versus a reinforcement based procedure? I don't know. I think it's something to talk about.
Yeah. I mean, to me, for its practical use, it doesn't teach anything. So when I think about one of the one of the side effects of punishment, or one of the problems with
what teaches somebody not to do something, punishment involves learning. So you are teaching somebody, learning is occurring. I know what you're saying, but I'm saying it's not that you aren't teaching something, learning is occurring. But you're not teaching an alternative necessarily, but you are teaching something. There's learning occurring. But it's not, punishment isn't the type of learning we want necessarily, the only type of learning we want occurring, I guess I should say. Does that make sense?
Yeah, well, the only reason I bring that up is because specifically in the ethical code, it talks about how if you're going to use punishment, you need a reinforcement component to teach alternative behavior. And so if someone's just using a DRO...
Right, yeah, I got what you're saying. Yep.
You can... Practically, it's a punishment procedure, and you would need to supplement it with an alternative, with teaching alternative behavior. That's all.
Yeah, right. No, I get you. Right. Oh, that's a good point. Right. So even if you're using a DRO, let's say it is a reinforcement-based procedure,
right?
It's about as vague as you can get, right? You're I'm teaching anything.
Everything.
I'm teaching everything as an alternative to doing this. And I don't know, like, I feel like that's
weak.
Yeah.
That's weak sauce, guys.
Yeah.
One thing that I thought about that I think it's a great thing that you brought up about like how there might be things that we do in kind of standard practice that maybe we should think about whether that should be standard practice. And because I think in all these cases there are examples of when it could be used, but just thinking about like people's default programming, I think about like timeout too, because timeout is considered, kind of in any kind of normal behavior mod package. I use parent management training, which is from Dr. Kasdan from Yale.
Okay.
And they have a timeout component that they teach parents as like I think it's in the third week of 12 weeks. So it's like very soon that they're starting the timeout. And so, I've questioned that. Like I've actually skipped it for people parent training because it seems like to me it should be like 8th or 9th week at least, kind of. But
yeah.
Anyway, so timeout is one of those. Can you think of other ones that are kind of like people use as defaults for behavior mod programming, but maybe they should think about it more?
Yeah, right. What about like response cost? So you have a client or something, maybe they have a token program, and maybe take away a token if they do something like that. Kind of, it's nothing crazy. I feel like it's something that you could see like often when you're looking at programs, but when I think about that, I'm like, well, that's like in negative punishment contingency, or it could be, right? Or if it's effective, it probably is. Like
right.
If that matters, it's a punishment contingency,
right?
And so my thought with that is, by all means, it seems like that could be necessary to have an effective program, but whether or not that's like part of our initial package or if it's an added component when like reinforcement alone hasn't worked. Do you know what I mean?
Yeah, that's right. So I was thinking about the kind of, and this I think is similar to like our previous episode on kind of the follow through ABA, and I think like of the battles that are kind of fought over restoring the environment if there's any property destruction.
Oh yeah, the restoring the environment. Yeah, good one.
Yeah. It's also like the last two, I think, any of these, right? I feel like because as a side effect of these, one of the problems is they're used out of spite.
I think the restoring the environment one is a big one. And I think that this is something, it's not even, I've seen it used by BCBAs who obviously have extensive training, but I've also just seen it used as like a kind of a default by like teachers and people who aren't
like
trained in behavior. And yeah, it's kind of like I would consider that like in some cases that is a default strategy where if a individual like throws something or does like property destruction or like some like minor like environmental disruption, having them like pick it up or fix it or do something like that is kind of a default strategy. But yeah, I don't know that it should be.
Yeah, I mean,
function should matter, right? Like,
yeah, exactly. Hey, sorry to interrupt, but if you're a BCBA and you're interested in getting ethics CEs for listening to this episode, you can purchase them at functionalrelationspodcast.com. Each episode is worth 2 ethics CEs, and you'll need to provide 3 code words when you go to check out. The first code word for this episode is minivan. Daddy used to have a Camaro, but he had some kids, so he traded it in for a minivan. 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 Minivan.
When I think about one of the problems with maybe using that as like a default strategy is I could see it going bad regardless of the function. So if you don't know the function of problem behavior and somebody like throws something and you're like, oh, we got to pick that up. And maybe you do like some hand over hand prompting to have them do it. Let's say it's attention maintained behavior. Probably not a good contingency there. Let's say it's escape maintained behavior.
Yep.
During instructional time, I feel like if you have somebody working on restoring the environment, you might be like going down the rabbit hole and kind of like getting off the path. So like if you're having a student like do like, I don't know, sorting at a desk.
Yep,
I'm just making up some random program.
You're making up
like,
a random program that would have a bunch of things to throw.
Yeah, right. So, and like, let's say they like throw an item like maybe not necessarily even related to the task. And then I'm like, all right, well, now you have to go pick that up. If they're doing that to avoid doing the sorting activity, not only could I be like reinforcing that with avoidance or escape from that activity, but then I also could be having them do something that's also aversive and unrelated to the task. So in some way, it's like it could be like a punishment procedure, or just could evoke more escape maintained behavior, and it feels like so messy to me. It feels like you're all of a sudden like you're in this situation where it's chaos.
Yeah, well, you had a battle which was about the work, and now you have a new battle. So now you have two battles. You're fighting on every front.
That's right. And if you fight on too many fronts, you lose the war. I think it's just important to like focus in on like what's the function of the behavior and how does this intervention component affect it. In some ways, it may be reinforcing like inappropriate behavior. In other ways, it may just be like functioning as like a positive punishment procedure.
Right.
Maybe. Doesn't mean you like wouldn't maybe want to include that under some circumstances, but whether or not it's necessary, I think that it could be seen as that component is part of like an escape extinction package.
Right.
But my question would be, could I implement escape extinction with my sorting program without having somebody pick something up? Could I just say, oh, we're still sorting,
right,
and not even get into like having them pick it up and still be effective? Maybe.
Yeah. So when we kind of think about where we're at with this, I don't think we're saying that you would never use punishment, right?
Or that you wouldn't use each one of these and that they couldn't be like perfectly appropriate and best practice and all that kind of stuff. Like these are, I think, interventions that have all been seen as at least like important components to some intervention packages, right? I think the question that I have is, should these be like initial components to treatment packages or like sort of like default interventions?
Yeah.
When I think of default interventions, I think of like positive reinforcement systems. All clients should have a positive reinforcement system to promote appropriate behavior.
Kind of like universal practices that you might use for, you got a group of people with developmental disabilities who are in a classroom or whatever, and when they come in the first day, what are you going to have for them, right?
Right.
You're going to have a token board. Maybe you have a token board. Maybe you have a schedule. I mean, these are like kind of like these basic components.
Yeah.
And it's like, are you also going to have a restoring the environment rule or a, you know what I mean? Like a DRO or what, should they be your first go-tos?
Right. Or should those be things that after positive reinforcement alone has been ineffective, that you then are like, well, actually, I need to add in, I think, maybe a response cost component. Or maybe during work tasks, I need to add in like a restoring the environment component. But like, yeah, should that be like a general strategy that you implement with every client right off the bat?
Yeah, exactly. And then when you do use it, I think just from this conversation is the first time I've ever thought, oh, because I don't use a DRO that much, but it's like, oh, if I use the DRO, I need to have an alternative behavior that I'm increasing. That's like probably the ethical thing to do.
Yeah.
I don't know if I've ever thought about that before.
Yeah. Honestly, when I use a DRO, I'm thinking, I think I need a negative punishment procedure. And then I think DRO. Like that's just the way I think about it.
Yeah. Yeah. Okay. So we've talked a lot about these different procedures and kind of how we view them and how we use them and how maybe we should be thinking more deeply about the way we use some of these.
But I think it'd be great if we got a couple guests on here to give their perspective on some of the things we've talked about.
Yeah.
So are there any questions, Zach, that you think would be helpful to get some input on?
Yeah, I'd be interested in getting some other people's perspective on the use of aversives in the compliance code. So in the punishment section, they kind of intersperse the word aversive. And I'm kind of interested to see how people interpret that and whether somehow negative reinforcement should be considered. Like, should we not be using negative reinforcement unless it's necessary? Like, are there any considerations with the use of negative reinforcement as it relates to ethics and the compliance code? I'd be interested in getting other people's perspective on that.
Yeah, I think as like a field, I think it's like good just to have a conversation about like the use of aversive stimulation in general.
Yeah, did you have any questions that you thought would be valuable?
Yeah, so thinking about the procedures that we described that are kind of like common practice, I think. So procedures like DRO and having clients restore the environment.
Yeah.
The way we've been talking about them is that those procedures like that probably involve punishment, either like positive or negative punishment. And so
right.
I think it would be nice to discuss if they require special consideration for like ethical use of those. So I think I'd like to hear some people's perspective on that.
Okay. Yeah, those sound like some good discussions. Should we go find some people to chat with?
I think we should.
All right, let's do it.
Cool.
Dr. Joshua Jessel, thanks for coming.
Thanks for having me.
We're really happy to have you on. We know that you have a lot of experience in this area of the field, and so we thought that it might be useful, if you would, to first kind of quickly discuss some of the dangers or side effects of using punishment that people should be considering.
Sure.
Dr. Joshua Jessel is an assistant professor and the director of an outpatient clinic for problem behavior on Queens College in New York. He's also on the editorial board for the Journal of Applied Behavior Analysis.
First and foremost, inducing aggression is a huge problem, and it's particularly worrisome with larger individuals. You really don't want to get into those situations where your treatment is now evoking or even eliciting some other problem behavior that you weren't expecting. There's also the social acceptability of it. We're out there and we're with teachers, we're in the schools, or we're just, in shopping centers, and we don't want to create a poor representation of our field for people that see us resorting to what can be archaic measures, regardless if the procedures are effective.
Yeah, that's a good point.
So social acceptability is high up there. And there's some dangers with, modeling a repertoire of punishment, enforcing behaviors for individuals that are receiving those consequences. And then one last danger is that, the whole point of punishment is that it's effective. And what that does is it makes it particularly worrisome because it can be reinforcing now to the individual using it, which means they're going to use it more. And then there's the problem of overuse, and it can be used now for retribution rather than response-reducing techniques. So there are a lot of things to worry about when it comes to punishment.
Yeah, thanks for giving that overview. Yeah, I've been very cautious of it, kind of in one of your first points, just talking about like representing the field. I've been really cautious about it because I can't help but kind of see sometimes these, in some sense they're protests or they're people who are suggesting that ABA is a form of torture or may result in trauma. And so, this is an area where I'm especially cautious because when we represent our field, we want to come across as like the fun people who, like, when we come in the door, the kids are rushing over like, "Hey, so glad you're here," versus like going hiding under the bed, So
yeah, that's exactly it. We want to be seen as those people that has those those smocks filled with toys, filled with candy, filled with good things, not the people that are here to bring the stick. So,
yeah, right.
I think something Zach and I have talked a little bit about is like there's obviously procedures that are pretty straightforward, like aversive procedures, but there are also some procedures that I think at times come across as common practice in our field. Things like using DRO, maybe things like restoring the environment. When we're talking about it, they seem like they at times might work because they involve a punishment mechanism. Do you think that those procedures warrant special consideration ethically?
Yeah, so any form of positive practice definitely requires some ethical considerations. My analogy is to treat your patients how you like to be treated in a CVS or a grocery store. So if you spill something, they're not going to make you clean it up. They're not going to give you the mop, right, and say, look, restore the environment. That can be very belittling if you think about it that way. So all we need to do is apologize and pay for the product. So we should really think hard and try to use techniques, reinforcement techniques, before heading down that road of positive practice. DRO, on the other hand, that's a different story because you're just delaying the presentation of reinforcers. So a DRO procedure may not even be punishment in that sense. If you have a very short DRO interval, it could be satiation that's working to reduce the behavior. And if your interval is long, it could be extinction. So I don't think we should go down that road right now, at least, to consider the ethical nature of a DRO because it may not be punishment, really.
Okay. Yeah, that's a good point.
Would there be any situations that you'd be cautious about using a DRO for ethical reasons, or?
Honestly, it isn't even my first choice, really.
Okay.
So when I use DROs, it's when I know that the individual has an alternative appropriate repertoire already established. So that if I use this DRO, it's going to reduce some sort of problem behavior, and also they're going to go to that response repertoire now. So for those that don't have some sort of alternative, we have to teach them. We have to have contingencies in place for that contextually appropriate behavior to fill that gap in time. So I don't know if that answers the question, but I don't say DRO first. I say DRO after other forms of DRA, FCT, and teaching techniques.
Okay. Yeah, that's a great thought. I think we mentioned how, DRO doesn't really, I think it's along the same lines of what you're talking about, just doesn't really teach anything, not teaching the things we're really wanting to teach. So it's not our first choice either. So that's a good consideration.
Yeah, I guess that does fit in the ethical guidelines of you want to promote learning in your treatment.
Yeah.
So DRO should probably come with some sort of package at the very least.
Okay. Yeah, great point. So the ethics code related to punishment references the use of aversives. So I was wondering, this also would include essentially negative reinforcement, or at least how I was trained. Negative reinforcement includes aversive stimulation. So should we not be using negative reinforcement unless it's necessary in the same way as punishment?
I would say you should never be using negative reinforcement alone. So a child will always have to experience, less preferred contexts or activities that they'll want to avoid, like class or boring conversations with others, or even games like Monopoly, especially, So they're going to need to learn to tolerate those situations. But the point is for us to enrich those environments when you can ensure that they're earning positive reinforcement, also in addition to the chance to escape. So they're escaping to something. We never want to set up a situation for a child where it's just negative reinforcement. This is also in terms of functional analyses. It goes beyond treatment. It's functional analysis, and treatment should always be a situation in which there are multiple reinforcers available at all times for the child.
Yeah, that's a good point. So really not using, in the same way we probably wouldn't want to use punishment alone, we wouldn't want to use negative reinforcement alone. Is that fair to say, you think?
Yeah, I definitely agree with that.
Cool. Are there other ethical considerations around punishment that you think is important for people to think about?
Yeah, for sure. There's a lot. There's a lot to think about. First and foremost, you should avoid positive punishment, specifically as much as possible. Even before moving to thinking about punishment, always start with functional analysis. And some of the work we've shown is that a practical functional assessment that can be used by clinicians, teachers, parents, they tend to lead to large reductions in problem behavior without the need for punishment. So definitely start there and start with function-based procedures.
Yeah, that's a great point, because actually in episode 2 of this season, we have the ethics of using or not using a functional analysis as part of your FBA. Yeah. And so this point was brought up, and I think it's great to bring up again, because if you're going to use some procedure like punishment, in fact, when we had Dr. Sarah Bloom on, she talked about how like one of the great advantages of using functional analysis is that we can avoid using punishment.
Yes, for sure. There's also a second advantage to doing a functional analysis in terms of punishment, is that you can now use function-based punishment procedures. So you're looking for those mirror image contingencies. If the child is engaging in problem behavior to escape from a workstation and to gain access to their iPad, well, we now know that if you remove an iPad and continue to present work, that would work as punishment, rather than going through our ethically ambiguous list of possible positive punishers.
Right.
We can use things that are related to the environment that's at hand.
That's awesome. So, Caleb, have you thought about that before? Because I haven't.
Function-based punishment?
Yeah.
It's actually, so that's funny, because I remember it was years ago, I brought up this idea of function-based punishment, and I didn't really know that was like a real thing. Is that a real thing? Do people like talk about punishment in terms of function-based punishment versus arbitrary punishment, the way you would arbitrary reinforcement?
Yeah, you can't quote me on this. There is an article I've seen, I think it was Dorothy Lerman. You might want to look this up and cut this out.
yeah.
I'm wrong.
We might have to cut this piece out, but I'm just curious for my own, because I remember a conversation. I was like, well, you can use a function-based punisher, and it just didn't seem like that was actually a thing.
Yeah, it's definitely a thing. It's just not talked about very often, but it should be.
Okay. Intuitively, I guess it makes sense, right?
Yeah, I really like the point.
Yeah, and I don't like that. I feel like we're going down that mad scientist route, trying to find beakers and vials that are very dangerous, when you think about all the different positive punishers we have out there.
As like a side note, I was reading for this class I was teaching, and they're talking about different types of positive punishers, and there was this little they just inserted this as if it was just like in passing. There's like water mist and blah, and then there's contingent tickling. And I was like, contingent tickling? I need to know more about this. So I looked it up. It was like 1971, I think, or something. And it was the use of contingent tickling as a positive punisher. And that was, I don't know what the word is to describe that.
Yeah, our technology of positive punishment is outdated and, quite frankly, dangerous. So
yeah, that's right.
We've got to avoid it as much as possible. So there's this program I've been working on for error correction and discrete child training, and it's called the losing little, gaining more technique.
Okay.
And what it involves is transitioning between rich and lean reinforcement when the child makes a mistake. So there's nothing aversive about what we're presenting during these times, and in fact, we're enriching the environment by including rich and lean reinforcement at all times, whether or not they're right or wrong. It's just that transition between the two that can be considered punishing. So when you're earning $1 for an answer, that's great. But when you're earning $50, that's much better. They're both good. But then when you go from earning $50 to then earning $1, that's when you tend to hit that transition.
I like that.
So it looks great because they're constantly earning good things. It's the child with autism that's earning M&Ms and then pretzels. But it works as punishment from our perspective.
Yeah, that's awesome. Is there any other things that maybe we didn't talk about today that you think are important? Or
Yeah, sure. Let me see if this works out.
If it doesn't, we'll cut
it. Yeah. In general, the discussion of punishment should be theoretical. It should be a conceptual discussion. And we should be sticking with our function-based treatments, providing a more comprehensive evaluation and understanding of treatments that are socially acceptable to others, and really avoiding the punishment talk unless it's entirely necessary, because the better we get at improving our positive reinforcement techniques, the less we'll have to rely on punishment.
Yeah, that's right. Yeah, and the better we come across to the wider world, right? We're going to be more socially acceptable in general. I have this thought about, like, there are people essentially that from the 1990s that received treatment as a young person diagnosed with autism, and now they're adults, and we essentially taught them to communicate, and we taught them to be able to use language in a way that now we're able to have them reflect back on the time that they had in the 1990s when they were kids. Mm-hmm. And some of them are saying things that are quite disturbing. Yeah. And so as we evolve as a field, we hope that we can kind of alleviate the concerns that people might be having about that, because we've improved our technology over the last 30 years.
Yeah, that's a good point. We often think of social validity of the caregivers or social validity of the teachers, but we need to worry about the social validity of our actual patients and what they're going to say about what we did 10 years later down the line or 20 years later down the line.
Hi, Bob and Paulo. Thanks for being here today.
Thanks for inviting us.
Thank you.
Yeah, no problem. So, like we've discussed, the theme of today's episode is regarding the ethical considerations with the use of punishment. I thought we might start out by asking Paulo a question. Maybe you can start off by just kind of giving an overview of some things that should be thought about when considering using punishment, and then also maybe what are some of the dangers and possible side effects of the use of punishment?
Sure. Punishment was really well studied back in the, let's say, late 50s, 60s.
Dr. Paulo Guilhardi is the Executive Vice President of Operations at Beacon ABA Services.
And then for ethical and other reasons sort of faded away. And I don't believe you would find as many studies as you would today than relative to back then. There are good books that have good reviews, like Honig has a whole big book in a chapter in punishment and so on. But there were a lot of studies doing in animals, and there was always a question of whether does punishment work. The question was, does it work? And there may be conditions in which it can be effective, but there are a lot of conditions under a lot of things to be considered. Some of them are, for example, to say the effects of punishment on reduction of behavior are typically temporary. So they work while the punisher stimulus is in effect. Once you remove that, response recovers. There's also things related to the intensity of punishments. We see a lot of studies were done that show a recovery of responding when the intensity of punishment is mild, for example. And so if someone is working and attempting to use punishment with a mild stimulus, and responding would recover, and then you increase the intensity of the punishment, the recovery will happen again. All of a sudden, you're going into intensities, and the procedure is not effective. And so our When you think in terms of applied research, there are two reasons why I would say that's not the ideal choice or acceptable choice. The first of it is there are alternative procedures that we can use, which doesn't require the use of punishment. For example, the concept of a differential reinforcement is a big one. We know we can strengthen and weaken different topographies by differentially reinforcing them and not appealing to any use of an aversive, of an addition of a non-aversive stimulus to reduce one.
But if you want, if I jump in, because I always think that we need to separate the issue of process versus outcome when we talk about punishment.
Dr. Bob Ross is the Chief Clinical Officer at Beacon ABA Services.
Because, again, punishment is something we say has occurred if rates go down. Now, the question is, what makes rates go down? We are very egocentric as human beings in looking at how we describe punishment. And if we don't deliver something that we think is bad, it's not punishment. So when we say to a kid, hey, please don't do it, I don't like it when you do that, we don't think we're using punishment. But if rates of the behavior go down, that feedback must function as an aversive for the individual, so much so that they don't do it anymore. That is punishment a description we use for how we feel about it, or is punishment a description we use based on its effect on rates of responses? And we as a field try to have it both ways.
Hey everyone, it's Zach again. If you're interested in getting CEs for listening to this episode, the second code word is campfire. I like roasting marshmallows around the campfire. 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 Campfire.
This is something that I've kind of thought about and talked about a little bit to other people in the past, but the use in the field of DRO procedures, I often consider that a punishment procedure. And I feel like it's related to what you're describing right now, where something is typically delivered. So there's some reinforcer delivered and you engage in some sort of behavior and that delivery is kind of canceled. I believe in Catania's learning textbook, he does kind of describe this as a punishment contingency. What are your thoughts on that and maybe some considerations with the use of DRO?
A DRO is one of those, to me, really disingenuous descriptions. We don't collect data on anything increasing when we do a DRO. We have one purpose and one purpose in mind. When the behavior occurs, right, the problem behavior, we're going to remove access to reinforcement in hopes that rates of that problem behavior go down. When it doesn't occur in that pre-specified DRO interval, we're going to deliver a stimulus at the end of the interval. Reinforcement by definition is the contingent delivery of a stimulus following a behavior that results in an increase in behavior. We don't measure any behavior at baseline, we don't deliver a stimulus contingent on a response, and we don't measure whether rates go up. We don't care when we do a DRO about rates going up. What we're doing that procedure for is to withhold reinforcement when the problem behavior happens to make rates of it go down. It's a very disingenuous description, and the outcome that anyone's interested in is not reinforcement, and by definition, it doesn't meet our requirement for calling it a reinforcement procedure because the reinforcer isn't delivered contingent on any response and no rates of anything are measured to go up.
That's a great point.
We deliver a stimulus that in the past we've believed functions as a reinforcer for the absence of problem behavior. But we really, to be clinically honest, people don't use it to make things go up. And I think this is one that actually should be a real ethical concern in the sense that we have an obligation to reinforce adaptive behavior. In a DRO, what you're really doing is saying, I'm too lazy to bother to teach a new skill and a new behavior, not a functionally equivalent replacement behavior. All I want to do here is withhold reinforcement when you do bad things. That's lazy behavior analysis in my view, and it's probably something that we as a field need to stop doing. DROs are essentially us failing to bother to teach a new skill and new behavior to a kid who we believe we've identified the functional reinforcer and we're going to withhold for problem behavior, but we're not going to teach you how to get it. We're not going to give it to you for adaptive behavior. To me, that's sort of disrespectful to the clients we serve and really inconsistent with a sort of positive support and functional communication perspective.
Yeah, I can understand that. And part of our discussion, actually, Caleb and I, in the first segment, we had discussion about how there are procedures that we use in the field that people maybe use without thinking, right? So they've maybe are thinking of procedures and not processes, which is to say that they're just doing something that they taught, like, oh, this is a procedure when I want a behavior to go down, and then we'll put it in. And we know that we have an ethical code that should limit the use of punishment procedures, and maybe DRO is flying under the radar as one of those procedures that just gets used as a default without making attempts at positive reinforcement first, which is specified in the guidelines.
Yeah, I think you could do a whole podcast on the problematic issues with DRO. I mean, usually the reinforcer that's being used isn't actually related to function. So it's some stimulus that we think is a reinforcer, but unrelated to function. So I might like the snack you're going to give me if I don't engage in problem behavior, but that isn't why I'm engaging in problem behavior. And as long as you're still delivering whatever functions a reinforcer for that, withholding the snack at 1 hour or 15 minutes or 5 or 10 minutes, sometimes I'll get it, sometimes I won't. DROs will be ineffective simply because it's unrelated to function. And then there's the whole IRT issue and how is that interval even determined? There's a lot of understanding our science that is missing in the application of DROs.
Yeah, you could have a situation where you're looking at competing reinforcers rather than teaching a new response or a better response.
In some ways you're kind of looking at a behavior modification procedure, right? If that's the case, like using arbitrary reinforcers.
Yeah, I think that as people tend to sort of describe behavior modification now, procedures absent sort of a relationship to the basic science, I would definitely agree with that statement. So mechanical procedures as opposed to science-based. We haven't identified the functional reinforcer for this kid. First of all, how can you withhold it when they engage in problem behavior? Right? And what is your interval? If they're essentially engaging in some problem behavior on average every 15 minutes to get it, and you set the DRO interval for half an hour, you're going to put them in deprivation. They're going to engage in problem behavior. They're not going to contact the reinforcer. This isn't going to be effective. And so there's science based on the application of procedures that was well researched back in the day. I'm not always so sure that is taught as well in our applied world and in our clinical settings as it needs to be.
There's also getting back a little bit in terms of what are the contingencies the model was to do this? By doing consultations in schools and working, typically the concern a client or a parent or a school bring is, how do I get rid of the problem? So we are asked to do. I mean, the first question you have is, I need to get rid of this. So we are kind of being induced to think about a behavior reduction. And then typically the first question I might ask is, okay, what are you trying? What is the alternative? And a lot of times when you ask that question, the person on the other side, the client, or even another behavior analyst, they don't have that answer clear. That's the first problem. In order for you to treat any problem behavior, you first thing you need to know is what is the behavior you wanted to teach or to replace that. I mean, it's easier to define the behavior if you know exactly what is the goal or what is the function, what are the consequences that problem behavior are producing. So you're not attempting to teach a replacement behavior that is not in fact a replacement behavior, but it's just something else that you might like. And at that point, you're no longer generating a new set of skills that will replace the other one, but you're just changing sort of the allocation of responses to a different reinforcement. Once that you are satiated on that reinforcement, or that's no longer temporarily not a reinforcer, you will go back to the old pattern. So I think when we are driven by our community or requested to think about a behavior reduction, the first thing we need to do is, can we define what we're going to teach? And then the second is how we're going to teach. What is the most effective way of doing? And when we take back, I know there are some concerns here that we discussed of whether differential reinforcement extinction is a type of punishment. I mean, it's very different to think about an extinction when you're teaching a replacement behavior or versus a positive punishment in which you're introducing a particular known aversive stimuli to eliminate a behavior. It's very hard to find any scenarios in which this would be justified. And typically, when there are justifications, has there been a careful analysis to understand why are the things that we know to work, like differential reinforcements, is not working at that moment?
Yeah. I think Paulo made, to me, one of the most important sort of statements that we need to make and recognize. When most behaviorists, particularly working in a school or home setting, go into that setting, people don't call us to say, hey, come in and teach this kid. They come in and say, bad things are happening, make it stop. So we are, by definition, to reinforce the people who are asking us to come there, we have to make bad things stop. And we have to sort of find a way to overcome that tendency to be reinforced by making bad things stop and be reinforced by making good adaptive behavior start. That because the tendency to go in and say, all right, we're going to put that behavior on extinction. And if we had an ethical code that said, before you can do extinction in an applied setting, in a public school, in a family's home, you have to do an assessment as to whether or not that setting can support the use of an extinction procedure. So will the classroom teacher withhold reinforcement when the child escalates and does some other problem behavior? Because if they will deliver reinforcement, then you're not allowed to do it. If mom and dad are going to reinforce the escalation, and we would see about a 99% reduction in the use of extinction, because the clinical settings where people complain about the teacher not being consistent, the parent, is because they haven't bothered to assess whether that setting can support the use of that procedure, and it almost never can. And what it can support is teachers delivering reinforcement for adaptive behavior, and that's what we've got to be better at.
To add to this, I think extinction is not necessary. Differential reinforcement doesn't imply all or none. All you need to have is a discrepancy. And so in most of the scenarios when you are working in an environment that is not as controlled like a lab, or you are in a home, you are at a school, in a classroom with one teacher and 20 students, it's very hard to find any teacher that would be able to maintain extinction at a high fidelity. And so a lot of the focus, I know we're moving towards an extinction discussion here, but
yes, and what you may not know is that, this being episode 4, episode 3 was about the use of extinction, and you maybe haven't listened to this episode yet.
Now, going back a little bit, Zach, we were talking a little before some of the side effects of the punishment, and this is what when we are doing behavior reductions and you use a mild punisher, which is probably what happens on a natural environment, is a parent giving stop that, or so giving please cut that out, is a teacher maybe talking in a certain way, and so on. You will see a temporary reduction on that behavior and relief. So that teacher, you got to think of the contingencies of both the teacher and the student. The student is obtaining.
I think is better than a reduction. You see a brief interruption in the behavior. You generally almost never see a reduction in it.
That's correct. And so in the long term, you're not reducing, but you get on the side of a particular teacher or an environment, and even as a behavior analyst working with a child, you will see you are under an aversive condition, which it is a child is engaging in problem behavior. So you are going to do everything that you can to either postpone, avoid, or to escape, to interrupt. And so that teacher will use, or that person working with the child is reinforced momentarily by using some mild forms of aversion, but that's not a treatment. This is contingencies in play, and then when we're talking about treatment, we're looking not only now, but we're looking in terms of the will be the development of the pattern of behavior, and so at that point is when if you don't have reinforcement contingencies in place, this will never, that long-term treatment is not going to occur.
Yeah, I'd actually argue that the contingencies of reinforcement are in place are being used by the child and not the teacher. The teacher has this aversive condition. Child's interrupting, doing some problem behavior. Teacher does something relatively ineffective, like Johnny, stop. Briefly, Johnny or Susie does, right? So the teacher gets reinforced for that statement. Now, Briefly, the child stops, and a while later, they're doing it again. The teacher uses the thing they've been reinforced for, that is an ineffective reductive procedure, but a highly effective interruption procedure. It results in the child delivering reinforcement by the removal of that aversive stimulus for the teacher, but not the teacher delivering reinforcement for an adaptive behavior or the removal of reinforcement for the problem behavior.
It's possible that you could be seeing the immediate reduction in behavior because it's a reinforcer.
Yeah, exactly. We have a post-reinforcement pause going on.
Yeah, so it could look like a mild punisher and actually be a reinforcer, or it could be a mild punisher that, just won't last long.
Yeah, when you look at rates of behavior, is the rate of that problem behavior going up, going down, or remaining stable? If it's remaining stable or going up, it's functioning to maintain it or reinforce higher rates. And that's almost always the case. But that's how you get some really interesting things in a public school classroom, like where the teacher will sit there and look at the kid across the room and go, Caleb. Why would someone say that in response to a kid being off task? And a little while later, Caleb stops, and a little while later, the teacher looks back again, Caleb. And Caleb stops briefly. Until the teacher's intervention, systematic intervention for Caleb being disruptive, is to tell Caleb his name.
You're bringing back memories for him.
I know, flashbacks of my school days.
But the idea that we're going to teach Caleb his name in an effort to get him to stop engaging in some disruptive behavior sounds on its face ridiculous, but it occurs because of the delivery of reinforcement for engaging in that behavior. And the reinforcer that's happening is the removal of an aversive stimulus to the teacher.
Yeah, that makes a lot of sense.
These contingencies of aversive stimuli happen all the time. That's what differential reinforcement is sort of predicated on. You can do high levels of reinforcement for the correct response, a low level of reinforcement for the problem behavior or the incorrect response, and I will avoid engaging in the incorrect response. Is that now a function of differential levels of reinforcement, or it's aversive to me to not get this good version of reinforcement? And this is the challenge. But either way, at least in this context, we have differential consequences shaping behavior in the direction we're interested in, as opposed to the only thing we're doing is the contingent delivery of an aversive stimulus, that the conditions here matter.
Yeah, when we think about ethics and our ethical code, we notice that there's the use of the word aversives is in there. And we were thinking, negative reinforcement also involves the use of aversive stimulation by definition. And so we were wondering, should we not be using negative reinforcement procedures unless we've tried positive reinforcement contingencies first? Do you guys have thoughts on that?
I do have. I think we should avoid as much as we can. I think when we're working with kids, when we are working with families and so on, we spend a lot of legwork on the beginning of a treatment, establishing ourselves as a reinforcement. And so what we are trying to do is pair ourselves with the stimuli that are typically positive in seeing. And that's what is going to allow you to push this child with more demands to get compliance and be able to effectively teach. Anytime you are pairing yourself with aversive contingencies, you are becoming an aversive stimulus, a condition aversive stimulus. And so, and that will, even though you might, again, momentarily had a potential good effect, on the long run, that particular child, we now work with kids between 0 and 3, that child will certainly start to kind of moving away from you when you come to provide treatment versus come towards you to teach skills. So I think anytime we're talking about, in order for you to set for a contingency, a negative reinforcement contingency, the aversive needs to be there. And in order to be there, you are pairing yourself, you're delivering, some contingency being set up so that the behavior will engage in the elimination of that aversive contingency. And that is, someone is putting that aversive contingency in place.
Yeah, the problem is they work, and they're too easy. It's a lot easier to set up an aversive condition and get a kid to engage in behavior to get out of it than it is to carefully apply reinforcement in service of shaping behavior over time should be the hallmark of who we are and what we do. But I think sometimes people look for shortcuts and easy answers rather than the hard work. And Paulo's point about making ourselves be the reinforcer, that is, we talk about that, and it shouldn't be lip service. It should be, our goal is to make this kid want so much to be around us and do things for us because there's such a great history of reinforcement. And that's what's going to make us effective as instructors. Not, oh crap, I got to avoid being wrong for this person because the price to pay is so unpleasant.
Yeah, that's a great point. And one of the things that I think about when I'm working with clients is, I guess, I don't know what the percentage of people in the field that work with people diagnosed with autism, but, one of the hallmark diagnostic criteria are that they may be finding social interaction to be less reinforcing. And then we set up a situation in which they're making it even less reinforcing. So we may be setting ourselves up for failure when we don't take the time to build the relationship and build trust.
Well, that's a good example to show that, if you are setting up an aversive contingency in there, that is probably when you're putting the treatment, you are exposing this client to social interactions that may be aversive. The question I have, are those aversive because they are aversive or because I lack this set of skills to be successful during it, and in order to be able to teach, we got exposed. So I always talk, sometimes this can come into sort of a more philosophical thing. Is it fair to expose this client, and when that question comes to me is typically, do you expose a child to a situation that is difficult and potentially aversive to teach some skills? The answer is not doing. You are not allowing this child to gain the skills to later make a choice of whether they want to be in that situation or not. And so I'm always into, until you experience both sides of the coins, you can't really make a choice about them. And so, usually the conversation I'll have with parents and so on is, we should teach this child to try every food, and then later say, I don't like this one or I like this one, versus not try and not have that, then it's not an option, So I see as the work into developing, having the repertoire to be able to work in varying situations, mean that now you are making a true choice.
But it always comes down to, we sometimes don't recognize, particularly for children with autism, that a visual discrimination task is something I'm good at, find easy, right? My visual discrimination, but abstract social language is hard for me. So if we don't carefully measure the amount of response effort and the amount and quality and magnitude of reinforcement for the task, so asking me to talk, which is really hard for me, it produces a small amount of reinforcement, it will become an unpleasant and aversive task. Whereas I do a simple visual discrimination with no language requirements, and I get the iPad, which means I also get to avoid more social interaction. We're actually differentially valuing non-interactive communication, and so we've got to arrange the contingency reinforcement to shape the things that we're interested in and the relative challenges that some of our kids face. But we don't always sort of carefully titrate the amount of response effort and the quality and magnitude of reinforcement for the kinds of tasks that we're asking a kid on the spectrum to do. And so we may be inadvertently making the task more aversive relative to some tasks that are easier for me to do and produce better quality reinforcement.
We talked a little bit about DRO and kind of how you kind of characterized how that's not really maybe described properly. Another procedure that we've kind of talked about on this podcast is restoring the environment. I feel like this is a very common procedure that I've seen across settings where if a child throws something, they have to pick it up, and it's kind of a default procedure. Do you think things like that might be common practice maybe require special consideration, given that's a potential positive punishment contingency, even though it is commonplace?
Well, first of all, yes, I think it requires special consideration, because anytime we do an intervention that is unrelated to function, it is as if we're not interested in effective treatment. We're doing it for us, not for that child. If the reinforcer for that kid is some engagement with an adult, then that's not a punishment procedure. It's contingent reinforcement. but we've got to make them fix the environment. No, what you need to do is learn for them to functionally communicate to get whatever they're getting for the problem behavior in a way that's easier, faster, and more effective. You need to make sure that it doesn't contact reinforcement when they do that, or certainly lower quality compared to the adaptive response you're establishing. If we do that, rates of problem behavior will go down, rates of adaptive behavior will go up. Now, if you want to also teach doing some other things and reinforce doing that, but the idea that contingent on the problem behavior, I'm messing up the environment, why is that kid doing it in the first place? Why is that particular learner doing that topography of response? Our science is founded on the idea of selection by consequence. So something that we typically do after they engage in that response is maintaining it. Well, the fact that they like something isn't our problem. The fact that topography response is necessary to get whatever they get is the problem. And that's where we should be putting our efforts. How do we teach them easier, faster, more effective ways of getting it so that topography response actually is no longer selected because it doesn't produce it as fast, as high quality, as effectively? That's what true function-based treatment's about. The idea that we're just going to make you clean it up after, without regard for teaching you a way to get it in the first place, we're never going to solve this problem.
Yeah, agreed.
For this example, too, I usually like a general rule of thumb, and I'm sure there are exceptions, but I always try to think the problem behavior should generate the least amount of change in the environment. And so if you go with that rule, if you are doing tasks and so on that are non-preferred and so on, problem behavior occurs, you continue doing what you're doing, you're eliminating setting up contingencies of escape. If you are, this child is engaging and then all of a sudden you're making them go pick it up and you are holding their hand and helping them do it and so on, you might be inadvertently creating a contingency of either punishment or if it's maintained by attention, of a high level of attention. And so I think as a rule of thumb, like as a general, given all equal and not knowing more specifics about the situation, the least amount of change the problem behavior produces, the less likely that behavior will inadvertently pick up, be reinforced somehow, and kind of and be developed and evolve.
But Caleb, I like the sort of line of comment you made, which is special consideration. I think the consideration was, is this explicitly related to the hypothesized function of behavior, yes or no? If it's not, then you need to make a higher case why you're doing something unrelated to function.
So I think that brings up a good point, and maybe kind of a good way to end this discussion is we've been talking about how we should probably avoid using punishment, focusing on the function of behavior, differential reinforcement. What are one of the times that you think it's appropriate to consider, adding a punishment component to a treatment package?
Well, here's the thing is that the consideration, first of all, I'm always going to consider our response to the targeted adaptive behavior and our response to the problem behavior, the behavior that we do not want to deliver reinforcement for. My general clinical practice is I rarely ever see the need in about 99.9% of the cases to add an explicit punisher. I want to diminish the quality of reinforcement. I want to make it less available, require more responses to get a poor version of it so that I get differential consequences. But there are individuals out there who engage in dangerous, life-threatening aggression and self-injurious behavior with the idea that if one more response of poking my eye out is going to result in me losing my vision, that some more robust interventions to make sure that this person doesn't permanently injure themselves in such a way, I think those are conditions under which, but it's a quality of life dangerousness to that individual and others that bring up that point of how immediate is this? How big is the risk? Those are times when that consideration to me may be something we should have a conversation about.
Yeah, and they should be considered also as a temporary measure to get you out of a crisis situation so you can effectively work in developing skills. You know? And so I would think there are very rare situations in which on what we currently do work in the kids, I don't see any situation in which that would be justified, but that's not to take that option off the table for certain conditions in which is a life and death situation. It could be, or permanent damage that will reduce the overall quality of access to reinforcement and quality of life.
I think the blanket idea that punishment is something we never do is a mistake, because reduction occurs. So we have a definitional description that we are all okay. We want lower rates of problem behavior, zero rates of problem behavior. By definition, if those go down, something we did reinforced adaptive behavior but resulted in what would be graphically, you see rates go down, what happened? And the answer is punishment relative to some other response maybe, and that's what the condition we should be okay with. But the idea that there aren't some conditions under which you might consider, and I think this is really the issue, temporarily doing something to get you out of a crisis, I think would be disingenuous to say that there's never a condition where that would make sense there.
Yeah, I've seen other, in a similar way, considerations on the use of punishment is, for those scenarios, is positive reinforcement of less intensive topographies of problem behavior. And so if you are at a place in which the topography might be so strong that you need to use, we might consider applying positive reinforcement for problem behavior, but in a much less or a lower intensity, because maybe the way to go is too far that you're never going to see behavior to differentially reinforce. And so there may be very specific situations, and I'm not here saying that this would be appropriate for every situation, but there might be cases in which that should be evaluated and carefully consideration. And in any of those cases, I would recommend having a peer review process in which those things are reviewed to ensure that different clinicians have looked at those situations and understanding. So there has to be a very good process to do. And going back to your point, Zach, also have any time in which, when you look at history, anytime that punishment is used, there's always that idea that reinforces the behaviors of the punishment, and we can lose control of the situation. So very clear guidelines, very clear procedures and checks and balances, and have to be in place in order for that to even be considered to restart.
Greg Hamley actually is pretty explicit about if you've got function right, you're far better off reinforcing the lowest level problem behavior and maintaining it to the exclusion of dangerous stuff. But when you think about in a classroom, I always say extinction has been tried when the kid's behavior is maintained by tension. The teacher doesn't do it anymore because when it happens, there's a level of escalation they can't tolerate.
Yeah, the kid's standing up on the desk and throwing chairs. Yeah.
So that's why they respond to a bunch of low-level stuff, and they're reinforcing the kid because they are maintaining low levels of problem behavior quite effectively.
Yeah, they're like reinforcing little precursors that they've become very, very good at detecting.
Yeah, and so they comment on all these things because the failure to comment on it results in the kid up in the ante to get that engagement from the teacher. So this is a tried and true, clinically used, even if it isn't always described as such. But differential reinforcement of low-level problem behavior is what maintains so much low-level problem behavior out there all the time.
And we're back. How we doing, Zach?
Here we are. I'm doing all right. How are you doing?
Doing pretty good.
We got to wrap this up.
Yep. So we had some good interviews with some guests about the use of punishment and how it relates to ethics. I don't know about you, but I really enjoyed listening to our guests. They're really smart people and very insightful, and I know I learned a lot just from listening to them.
Yeah, same here. I thought it was like a good kind of reminder of these things, so things that, I learned in grad school or whatever about punishment, like, oh, we should be kind of cautious and whatever, but it's easy to kind of fall into the just kind of everyday stuff that we do, whatever, and we don't really think about things. It's good to, just go back, refresh ourselves on these type of things and learn a bit in in the process.
Something I really liked was that at times things got really conceptual, right?
Right.
But it also always came back to everyday in practice kind of situations. So I thought that was nice. I think we saw like kind of both sides of things, the conceptual analysis of punishment and the implications around that, and then how it relates to, real world situations that we all encounter each day.
Yeah. Good point. When we were talking to Dr. Jessel, I thought he just did a nice job of kind of outlining some of these side effects of punishment that we really already know. We know these things, but hearing it kind of refreshing a bit and hearing his take on it was really nice.
Yeah, exactly. So, as I'm sure we all remember, punishment can have some pretty nasty side effects like aggression. You can elicit aggression from individuals. Also, people just might not find it that acceptable.
Yeah, so when we talk about like eliciting aggression, that means that it's a respondent behavior that is just a stimulus response relation, right? So it's just happening because of aversive stimulation being presented. That's just a natural biological response to coming in contact with that type of stimulation. So
yeah, exactly. So as a result of providing aversive stimulation in a punishment procedure, you could end up with some problem behavior that otherwise wouldn't have occurred because there wouldn't have been aversive stimulation.
There you go. That's not what you were trying to do, was it?
Right. I think another point that is very important is like, even if punishment is effective, right? So if you're using punishment, it should be effective.
Well, otherwise it's not punishment, right?
Right. But if you're providing I guess what I mean is if you're using an aversive procedure, it sure as heck better be effective.
Right. If you've planned out, if you're trying to use a punishment procedure, it should work.
Yeah. But my point with that is Dr. Jessel said that one of the effects of implementing an effective punishment procedure is that the behavior of implementing a punishment procedure may be reinforced and you may be more likely to overuse it, which is not what you want to do.
Right. Yeah. Because it's so successful, we want to do it more. And we have to have safeguards in place to make sure that stuff doesn't happen.
Right. So even if we're using punishment and we're properly using it in like a situation where, we've determined it's needed, the dangers don't stop with that. Like there are risks that go beyond just that situation, which is possibly the implementers themselves could be more likely to do it. Right.
Yeah. And I think this is why, and actually Dr. Paulo mentioned this too, because he said, it was actually kind of at the end, but he mentioned if we're going to use punishment in a crisis situation or something like this, the people making the decisions about it should be maybe a step away from the situation itself. Like he mentioned like student rights boards or committees.
Peer review groups,
exactly. So having that in place is a good safeguard because the contingencies that are working on your behavior when you're delivering punishment, which is that, oh, it worked really well, I'm going to use that again, aren't the contingencies that are actually controlling who's using the punishment, because it's being decided by a group of people who their behavior is not sensitive to that particular contingency necessarily.
Right. So people making the decision to use punishment or not should be unbiased.
As less biased as possible. We've both been part of these groups, right? And if you come to a group and it's week after week, someone keeps telling you like, yeah, it's just not working. Things aren't working. And then they tell you, yeah, we used the punishment procedure and it worked great. Your behavior will be sensitive to that, right? But it's less sensitive than the person who's actually implementing it.
That makes sense. It's not like you're completely unbiased in the situation.
Right. Yeah, we just want to be as objective as possible. And making group decisions around it is I think, a good thing to do.
Yeah. We just talked about some of the unwanted side effects or dangers of punishment. A couple more that Paulo brought up that I thought were really interesting is that, even if you implement punishment and it results in a decrease in the target behavior, responding will recover.
Yeah.
Either if you withdraw the procedures or over time, And he didn't say this, but I'm assuming it's like a process of habituation or something like
Yeah,
that, where you might actually have to provide more and more aversive stimulation to keep the same effect in place. And that's not good,
Yeah,
right?
right.
If we have to keep providing more and more aversive stimulation, like where does that end?
Yeah, exactly. And we are always trying to use the least intrusive procedure that we can use that is effective. And so when we think about this in relation to punishment, we should be very cautious about the use of punishment because when we're using the least intrusive procedure, it's the right thing to do, but it also we know that there's this effect that can occur. So it's like we really should be just trying to avoid punishment at all costs because it can be a dead end road.
Definitely a potential like dangerous road, right?
Yeah.
It's so even if it's appropriate to use punishment, I think that's where at least the take home point for me is there aren't a lot of cases where you should probably even be using punishment, and when you do, you need to be super careful.
Yeah. I think that this also can lead to like, I mean, it's not a fun topic, but like if you think about how it can lead to abuse, basically you come in contact with situations where it's like someone raised their voice for the first time, the kid, stands to attention and they're like, oh yeah, sorry, I didn't mean to do that or whatever. And then they habituate to raising the voice. And then next thing you know, people are like kind of in their face raising their voice. And then they are like, they're like, oh, whoa, that was, that seemed pretty bad. And then over time, it escalates because you habituate to the most recent type of punishment. And so it can just get out of hand. It can get physical. It can get, bad.
And I'm thinking of the other side of that situation, right? So you have the individual, like the client, whose behavior is maybe habituating to that aversive stimulus, and therefore it's no longer effective. The person implementing that, there's a history of reinforcement for them providing that aversive stimulation, and that behavior presumably is undergoing extinction when it doesn't work.
Exactly.
And so then I'm just thinking one possibility is you could get like some variability in their responding, which it's more intense. Like your example of raising your voice, instead of raising their voice a little bit, because that didn't work, like extinction kicks in and now their voice raises higher and that works and that's reinforced. And so it's just not a good situation.
Yeah, right. Exactly. Yeah. I mean, I think that both Dr. Jessel, Dr. Paulo, and Dr. Bob mentioned that it's dangerous. It's going down a road that we don't want to go down as a field. And it comes when you come back to social acceptability, it's really just not there. Maybe it was, I don't know, was it there? Maybe it was there in the 70s, maybe it was there in the 80s, but for certain in 2019, we're just not really there anymore. And we've found better ways to manage behavior. We just have. That's our whole field has been developing over the last 50 years to find better ways to manage things. And we found great alternatives.
Yeah, I think a lot of that has to do in the evolution of functional assessment methodology and then also the development of better function-based treatment methodologies.
Yeah.
This was touched on by our guests in both interviews is function matters. And if you know the function of problem behavior, then probably for the most part, you're not going to need to use punishment procedures. You should be able to provide differential consequences and hopefully figure out a way to have individuals allocate their behavior towards more appropriate topographies.
Hey everyone, if you've been listening to this whole episode and you're interested in getting ethics CEs, the third code word is Daisy. She loves me not. She loves me not. Daisy. D-A-I-S-Y. Daisy. When you finish the episode, head over to functionalrelationspodcast.com to purchase the 2 ethics CEs for this episode. Yeah, and when we think about function, also when Dr. Jessel mentioned that if we are using functional behavior assessment methodology and we get the function, if we do have to use punishment, we can use a function-based punishment procedure.
Yeah, and apparently that's a thing.
Yes, and I think Josh would be happy to hear that his memory served him well, and it was Dr. Lerman who published that book chapter on function-based punishment, and you can check that out in the notes. We have a link to that because he was right, and we didn't have to cut out that section. So that's good. I'm sure he's happy about that.
So I want to talk about the conversations that we had about the use of DRO and positive practice,
Okay.
or like what we referred to as restoring the environment. Because I thought that there was some really good information that was provided in both of our interviews about the use of those procedures.
Sure. I like the example that Dr. Jessel had about if you're in the CVS and presumably don't have to like do any copyright. I don't know, CVS. If you're in a standard small pharmacy drugstore, it could be it could be Walgreens, could be I don't know. But anyway, if you break something, they're not like, they don't bring security over and like, they're like, son, you have to clean up all this stuff. You have to, before you, nope, you're not going to be able to leave. Here's the mop. Here's the broom. No, the term belittling is appropriate there. And it's just not how the real world works. So if we're looking for real world stuff, like making someone pick up the stuff is not really real world.
Right. And it just, the reason why a store wouldn't probably have you do that is because it makes them look not very good. Right? If I was like, hey, Zach, earlier today before we were recording this podcast, I was in CVS and this poor person dropped a gallon of milk and it spilled all over the aisleway, and CVS or whatever drugstore made the person go get a bucket of water and a mop and clean the whole thing up. It was unbelievable. I can't believe it. I'm never going back there.
Yeah, the security guard is a big guy and was doing hand over hand with that old lady. I don't know why they chose to use that as a company policy, but I'm not going back there.
Yeah. So the point is, in addition to it likely being an aversive procedure for the person that's having to do the cleaning up, it doesn't look very good.
Yeah,
right.
absolutely.
So if we were working with a client and our program was that the person had to restore and clean this stuff up, it kind of doesn't make us look very good or very socially acceptable interventions, right?
Right.
And I think the part of the conversation that I really liked around that is we need to know why these types of problem behavior are occurring to begin with, right?
Yeah. Yeah, Dr. Bob mentioned that basically like function matters. And the person, either it was an accident, in which case, I don't know, you might want to teach someone to like, be responsible and whatever. And it's fine to help them clean up, because that's what you'd probably do if you saw someone spill. They would start to clean it up. It was an accident. Everybody kind of chips in and helps clean it up. Or they did it on purpose. And when we say someone does something on purpose, it means that there was some operant function, and we're responsible for knowing what that operant function is.
Exactly. So we talked about this at the beginning of this episode, right? Where you could imagine, depending on what the function is, a positive practice or restoring the environment type of intervention could backfire, right? It could just be providing reinforcement for the problem behavior. And without knowing the function, there's really no way of knowing how that intervention might play out.
Yeah, right.
So the other procedure that we talked about was DRO. So in both of our interviews, I think we had some pretty good talk about considerations around the use of DRO, why it might work. So specifically,
right,
Dr. Josh made the good point of we can't just assume DRO is a punishment procedure, right? So it's possible that DRO, if the interval is short enough, it's effective due to satiation. So maybe it alters motivating operations in some way. In addition, it might just be extinction if the interval's long enough, right? So just you're withholding reinforcement if problem behavior occurs, in addition to, I guess, what we were talking about before, which is like the negative punishment possibility, right?
Right. And we'll link the paper that Dr. Jessel wrote on this topic from 2016 on recent advances in applied research on DRO procedures. So we'll stick that in the notes so you can take a look, because I love that point too. It's like he's been diving deep into DRO stuff and kind of seen the different ways it can function. So it's kind of neat that he's done that. But, I think there are also some concerns that our guests had, especially Dr. Bob Ross mentioned how, and I think he made a good point, that like when we put in a DRO, we're only collecting data on behavior that we're reducing. So in some practical sense, no matter what process is occurring, because there can be varied processes, but we're trying to punish the behavior. We're trying to get rid of the behavior, right? And so there may be different reasons. We may kind of know what the reasons are or not know, but basically we're not collecting data on all the other behavior that we're increasing with a DRO. So I think that's like an important point.
Yeah, and one thing to also consider is when we think back about why a DRO might be effective other than negative punishment. So thinking about altering of motivating operations through satiation or extinction.
Right. Yep.
Neither one of those processes teaches alternative behavior on its own. So extinction, even if it is not punishment, we wouldn't typically just implement extinction alone without trying to establish some alternative behavior. In the same way,
episode 3 alert. Yeah. Check out episode 3.
Right. And then satiation, like obviously, if you're just providing this on some time schedule or whatever, like similar to like non-contingent reinforcement, that's good because it's a function-based treatment. But at the same time, we probably still want to establish some alternative behavior, not just alter motivating operations to reduce the occurrence, right?
Yeah. Dr. Jessel basically said, I don't say DRO first. I put it as part of a package, and I make sure that there's already a repertoire of alternative behavior that person engages in before I put in a DRO. And I thought that was a great.
Right. So thinking of an example, if you have somebody who maybe engages in attention maintained problem behavior, it seems reasonable that you might not want to use a DRO if that person doesn't currently have another response in their repertoire to access attention appropriately, versus you have an individual who can currently man for attention a number of different ways, but often will engage in some form of problem behavior to access attention. Then a DRO might just help shift allocation of responding away from problem behavior into those responses that are already in the individual's repertoire, right? So that's kind of the example that comes to mind of when you may or may not want to include a DRO, if at all, right?
Right. And I think that goes back to, and it just seems like we could do this over and over again, but it's like it comes back to function. If you do have the function, then you can start to work on that sort of stuff. If you don't have the function and you don't know what you're going to do for an FA, episode 2?
And we're just plugging all the episodes.
Well, yeah, they're all important, Caleb. Or at least, I don't know, they're dear to our heart. Let's just say that.
Yeah, we'll also have to figure out a way to somehow incorporate episode 1 into this one.
Oh, yeah, exactly. So let's just put it this way. Like, if you're using a DRO and you're delivering something on a fixed schedule and you're delivering it to a client, let's just make sure that's not a gift, right? You just don't want it to be a gift.
Yeah, so moving on from that to talking about the use of aversive stimulation.
When you say
in
moving
general,
on from that, you mean that really good joke that I just had?
Yeah, that's questionable.
Okay.
The same way the use of punishment is questionable, that joke was questionable.
Okay, yeah, fair enough.
We really need to move on. So the question we asked was that, or you actually brought this up at the beginning of the episode, Zach, and you asked, the compliance code cites that we need to be careful, or there are considerations around the use of aversives in general. Like we should avoid the use of aversives. And you pointed out that negative reinforcement involves the use of aversive stimulation.
Right. I guess I've actually done a little bit of thinking about this too. And one of the things I've thought about was like, let's say there's a negative reinforcer in the environment that's naturally occurring, and you're using this aversive stimulation that's naturally occurring to teach a way to get relief from a naturally occurring aversive stimulation, I don't think there are ethical considerations about that, other than you should probably do it. Those are the type of skills you want to be teaching. The questionable part, in my opinion, is when you're using aversive stimulation to get something done that you want done, and it's not naturally occurring. I think that is questionable.
Yeah, and Dr. Jessel actually mentioned that, we should avoid using negative reinforcement alone in general. We should just avoid doing that, because we always want to set up a situation where even if negative reinforcement is necessary, as it oftentimes may be, just because sometimes people have to access less preferred environments. Like that's just part of
that's right.
Life in a way. But our job is to, as he pointed out, enrich those less preferred environments so that even though somebody might have to experience them, how can we make them better? How can we incorporate negative and positive reinforcement into those situations?
Yep. Yeah, that's in line with what Dr. Bob and Dr. Paulo said about pairing yourself and how important it is to pair yourself with positive reinforcement, because you can easily do the opposite. You could easily pair yourself with negative reinforcement, but then you have the situation where your client is, I think I use the example of like hiding under the bed when you arrive versus coming out and, greeting you and saying, that they're happy to see you. And Dr. Jessel mentioned something about like having what do you say, a cloak of good things or something? Like,
no, it wasn't a cloak. It was a smock.
Smock, yes.
What exactly is a smock?
A smock. Well, it's a coat.
It is?
It's an apron.
Yeah, see, I was thinking it was an apron. Yeah. I was actually imagining like a little tool belt or something. If you're a carpenter and you have like a little thing that's full of, keep your nails in it. I was imagining something similar to that, but with
a carpenter's belt.
Toys and treats.
Yes, well, I think Google Images says it's an apron, and it looks like it's an apron with a pocket, so maybe that's what he was talking about.
Okay. Makes sense. Yeah. So yeah, exactly. So if we are using a lot of negative reinforcement, the person who is providing that aversive stimulation is over time gonna become a conditioned aversive themselves, right? And that's not good. That's not good for relationships. Like you mentioned, we want clients to want to work with us, right?
Yeah,
and
absolutely.
If you're primarily using negative reinforcement, that's probably not going to happen, right?
So as kind of part of our wrap up, I wanted to say a little bit of something about that conversation we had with Dr. Paulo and Dr. Bob, because at the end we talked about how, our whole the whole idea of this particular episode is to talk about kind of the dangers and the side effects of punishment and the ethical considerations we should be that we're faced with when we decide not to use a punisher. And when we had that conversation at the end with Dr. Paulo and Dr. Bob, we talked about how we rarely need punishment, but there are maybe extreme situations where we might use it to get ourselves out of a crisis. And so I thought that was an important piece, because I don't think we don't want to take away a particular tool, a particular procedure from practitioners out there, because I think we've developed this technology for a reason and it's been useful to us. We just have to be careful, right?
Yeah, I would agree. And I think what it comes down to from talking to our guests is that it comes back to knowing the function of problem behavior, right? Like if you know the function of problem behavior and then you program differential consequences for appropriate behavior and you teach appropriate behavior while minimizing reinforcement for inappropriate behavior, for the most part, you should not need to use punishment, right? Or not even need to go down that road. And I think that the concerns that come up around the use of things like DRO or restoring the environment is that DRO isn't necessarily teaching an alternative behavior, right? So even if it isn't punishment, we're not really fulfilling our obligation to teach somebody an appropriate replacement behavior. And then with something like restoring the environment, depending on what the function is, that could be a not very effective intervention at all.
Sure. And I think the reason we chose DRO and restoring the environment to kind of zero in on in this particular episode was because we thought that these are some procedures that people might use and might be part of kind of our default programming in the field, but maybe aren't considered punishers because it has the word reinforcement in it, or restoring the environment is just kind of something we call positive practice maybe, or something like that. And so we just wanted to bring up this topic to maybe bring a little bit of attention to these procedures. And we want people to consider that they could be punishment procedures. And as long as we know what we're doing, as long as we consider all of the potential side effects of what we're doing, if it's the right tool for the job, you should use it. But we just want to make sure everyone is on the same page about what the processes that could be involved with using these procedures.
Right. We're just having meaningful conversation on relevant topics in the field of behavior analysis, right?
Yeah. Good. Nice. Oh, yep. Nice, Caleb. All right. So do you feel like we accomplished something with this episode?
Yeah,
You feel good about it?
Yeah, I mean, personally, I really enjoyed it. I enjoyed talking to our guests. I think it was helpful when thinking about the procedures that we discussed and just considering like the big picture and how procedures can affect the way we're viewed by people in the community and how our field is just viewed in general.
Yeah, sure. Well, so I also enjoyed it, and I want to thank our guests for coming on because, they really made this episode a valuable thing, I think. So I just want to thank them, and I want to thank you, Caleb. Thanks a lot. And I think I really appreciated this episode.
Always a pleasure, Zach.
Oh, and also Dr. Jessel wanted me to mention that there is actually a master's program in behavior analysis at Queens College, if you're interested. And there's also a PhD program. It's in clinical psychology, but you can have a behavior analytic mentor. Also, we wanted to shout out to FTF Behavioral Consulting, which is Dr. Greg Hanley's new consultation company, of which Dr. Joshua Jessel is a part. If people are interested in getting CEs for this episode, we've had the 3 code words that they'll just need to plug in. They'll go to functionalrelationspodcast.com and go to the CE section, and you can just plug in those keywords and get CEs. And then, we've kind of revamped our Patreon page. I don't know if everybody knows about Patreon, but basically it's a way that if you feel like that we're providing a good service to the field by spending our time recording these interviews and speaking to each other, and you want to support us, we have some small gifts that we can send out to your house, and you can get free CEs too. So anyway, check it out. It's in the notes section of the podcast here, and it's patreon.com/functional relations podcast. So thanks again. We'll see you guys in a few weeks.
Bye, everyone.